A 32-year-old man presents with persistent dysuria and urethral discomfort despite appropriate treatment. For chlamydia trachomatis, urethral smear shows more than 5 polymorpholeukocytes per high-power field. Which organism is most likely responsible? So what are the options?
These are the 5 options. Can you see?
Urea plasma.
What is the
No.
presentation here? It is a male. Okay,
Persistent dysuria, male, then
male we have, and it is a urethritis. Okay, diagnosed as a
chlamydia,
chlamydia trachomatis, taken
chlamydia
the appropriate
trachomatis.
treatment. Still, it is not controlled. Still, there is no cure. So, what it could
Yes.
be?
D.
Just now we have discussed, doctor, which patients non-gonococcal urethritis, we have to test them for mycoplasma. Okay.
Mycoplasma genitalium.
Association with persistent and recurrent NGU. Okay, this word I emphasize the sentence I emphasize there also. Okay, so detected up to 40% of persistent urethritis cases. Odds ratio is 26 for detection in persistent. Don't remember this minor. Remember the highlights. Okay.
Okay.
Chlamydia causes
Persistent and recurrent. Yes.
chlamydia causes non-gonococcal urethritis, but it is less likely after adequate treatment. Okay, so if it is only chlamydia, then it should have responded. Okay.
Okay, sir.
Association with persistent and recurrent NGU. Okay, this word I emphasize the sentence I emphasize there also. Okay, so detected up to 40% of persistent urethritis cases. Odds ratio is 26 for detection in persistent. Don't remember this minor. Remember the highlights. Okay.
Okay.
Chlamydia causes
Persistent and recurrent. Yes.
chlamydia causes non-gonococcal urethritis, but it is less likely after adequate treatment. Okay, so if it is only chlamydia, then it should have responded. Okay.
Okay, sir. Which of the following microbiological features best explain why Mycoplasma genitalium cannot be detected on gram stain? It is because it lacks a peptidoglycan cell wall.
Correct, correct. Very good. Actually, this is a part 1 MRCOG question.
Yes, sir.
So it lacks a peptidoglycan cell wall. Explanation: Mycoplasma genitalium belongs to molecules. There is no cell wall, not visible on gram stain. Beta-lactam antibiotics are ineffective. Diagnosis relies on NAAT. Okay. So specimen
Yes.
collection, first void urine for male, 98 to 100% sensitive. Urethral swabs are less sensitive. Metal swabs are inferior and inconsistent. Okay. So what happens when
Yes.
there is a urethritis? No, we get confused whether it is a swab to be taken, metal swab to be taken, what exactly.
Yes.
But just focus what we are discussing. First void urine. Okay. So
Okay.
for women, specimen of choice will be vulvovaginal swab. Okay. It is a good sensitivity, is around 85 to 100%. Endocervical has got less than combined vaginal plus endocervical is around 96%. First void urine has got a poor. Okay. So recommendation: explain the
Sir,
condition.
because this chlamydia causes cervicitis,
Yeah.
so why we prefer this thing, vulvovaginal swab, not endocervical?
Uh, Not very sure, but what is recommended is a vulvovaginal swab only they have mentioned. Okay. So see, these are few things
Because the
which are important.
cervical symptoms are too much, postcoital
Yeah,
breathing,
yeah,
painful
agree, agree.
cervical movements,
Yes,
but
yes.
still a
Still, they are
cervical
not.
swab is not recommended.
The recommendation is vulvovaginal only. Though the symptoms, the cervicitis is common, still
Yes,
the
sir.
vulvovaginal swab. Okay. So
Okay, sir.
recommendation, these are few points which we should remember from part 3 examination point of view especially. So we have to explain the condition and long-term implications. We will provide the written information. The patient should abstain from the sex until 14 days after the treatment start and symptoms resolve. Okay, and especially important if azithromycin is used, it has got a long half-life and test of cure is done for all patients. Okay.
Yes,
So
sir.
treatment of infection, this uncomplicated, this we have discussed, 100 BD 7 days followed by AZI 1 OD for day 1 followed by 500 OD for 2 days. Other is a 10 days of moxifloxacin. Do not repeat doxycycline if already given. Give azithromycin immediately after doxycycline. Okay, once you finish 7 days, then immediately you start with doxycycline. Okay, complicated moxifloxacin for 2 weeks. Okay, there is a difference between the, here it is 10 days treatment, here it is a 2 weeks of moxifloxacin.